Illegal mining, popularly known as GALAMSEY, continues to pose an existential threat to Ghanaians. Beyond the environmental destruction, health experts are warning of a silent crisis, including rising cases of child drowning, school dropouts, and serious health complications, which are linked to contaminated water and soil. Dr. Hilda Mantebia Boy is the president of the Pediatric Society of Ghana.
It's difficult to get clean water now in the areas where the Galamsey is especially. But we also know that with this poor water quality also, you tend to have a lot of cases of diarrheal diseases or people having diarrhea from the contaminated water that they are taking. Then neurologically, or if you look at the brain, issues of behavioral disorders or behavioral problems among children, even the common one called autism, cases tend to be higher in areas where there's pollution. Then you look at the skin diseases, the cancer, hematological system, you look at cancer, then the kidney, the liver, so kidney failure, liver failure. We have had a number of complaints or reports that are we are trying to inquire whether they are directly linked to the Galamsey. And indeed, we are actively working at collecting data and information to be able to quantify the numbers and try and map and see what areas these children are coming from.
Apart from the drowning aspects, the bigger picture, more invisible threats, is the poisoned water and food. Communities in Galamsey areas now struggle to find clean drinking water, leading to outbreaks of diarrhea disease and other serious health problems.
We know that the poisoned water, poisoned food has an effect on the health of human beings. Children, adults, everyone is affected when the soil is polluted, when the air is polluted, when the water is polluted. So all we are saying is that we don't also even need to sit and wait to have a lot of data about how many people are miscarrying maybe from the pollution or how many placentas are affected by the pollution, because we know that the pollution has bad effects on human lives.
While they cannot directly attribute all the cases to Galamsey, they admit that polluted water is a likely contributor.
Even here in Kolebu Teaching Hospital, recently there was a report that the renal unit, they've seen about 2,000 cases of kidney disease, which is higher than previously. We don't want to have children who are having behavior problems. We don't want to have children who are developing cancer or are even being born with birth defects, which are potentially avoidable. So it's really time for the government to take the necessary actions and steps to stop this illegal mining, to stop this Galamsey, and to stop this mass destruction that is going on in our country now.
Dr. Boy warns that the long-term impact of Galamsey can be devastating, affecting not just those living in mining areas, but every Ghanaian who depends on the food and water from these regions.
It's important that while the government is interested in improving the lives of Ghanaians, it prioritizes the issue of Galamsey, because Galamsey poses an existential threat on the lives of children in Ghana and on the lives of everyone in Ghana. So it should be top on the agenda of the government. And I believe strongly that if the government is determined to stop Galamsey, Galamsey will end. We should not be afraid of anyone because of the money they have or the influence or whatever. This is something that we all need to stand together and deal with to save our land.
The president of the Pediatric Society of Ghana is urgently calling on governments to end the Galamsey menace and protect the next generation.
As Pediatric Society of Ghana and all our members, what we are interested in really is for Galamsey to end. I think the government is also very well placed to take a decision to end it, and they will be also one of the best people to determine that this is the best way to go about it. If you declare a state of emergency and you do not do the things that you need to do within the period to end it, it will be a waste. If the government is committed, we are all committed to ending Galamsey now. We know exactly what to do to end the Galamsey.
As Ghana fights to save its lands and waters, health professionals warn that the real victims of Galamsey may not be the minors, but the innocent children growing up in a poisoned world.